This is Boston 25 News at 5.
About 70% of nurses in Massachusetts are unionized. Today, efforts officially began to boost that number even higher.
That's right. The target, nurses at Milford Regional Medical Center, I should say, as Boston 25 News reporter Jim Morelli found the catalyst for the organizing effort there, concerns about COVID.
Last spring, they were the poster children for the pathetic state of the PPE stock in Massachusetts.
Gowns, I guess we ran out of them, so the hospital began making our own gowns.
Gowns made out of 2 sheets of plastic. That is how nurses at Milford Regional Medical Center say they went into battle against COVID-19.
The hospital, I think, would say that that was a solution they came up with that was adequate and it protected us. But I think none of us ever saw them as anything other than trash bags.
Milford nurses say they sweated out the first COVID surge, quite literally, in those homespun gowns. But Monday, they collectively declared enough.
Close to 70% of the nurses at Milford have signed a card indicating their support for voting yes for a union.
Woo! Yay, here we go!
The hospital CEO got that news personally delivered about the same time as an electronic filing with the National Labor Relations Board.
A lot of our issues right now are communication. You know, we're one of the biggest teams in Milford right now, and we need to talk to each other.
The nurses say lack of communication has meant a lack of listening to ideas about keeping staff safe from the infection. And the result?
We've had 2 outbreaks on inpatient units with over 10 nurses in each unit affected.
Last spring, they put up with donated ponchos, trying to work while encased in plastic, they say. But the second surge has finally pushed the nurses at Milford Regional over the edge.
Nurses are often really stoic. We don't cry and run around with our hair on fire. We just buckle down and do the job. So when we speak up, there's a really big issue, and we really want people to listen to us.
Jim Morelli with that report. He joins us now live in Milford. And Jim, did the hospital have any response to the nurses' petition to unionize?
Well, the CEO, Ed Kelly, was not in when they went to drop off their election petition, but I did get a statement back from Terry McDonald. She's in the marketing department at the hospital. It was a very general statement. Basically, she said that safety of staff and patients was their priority. And as far as the PPE goes, she says that they basically followed the strict protocols set out by the Department of Public Health and the CDC. And she said that extraordinary efforts went to provide the staff with PPE, again, that met those strict protocols set out by DPH and CDC. And I don't know there if she was referring to the sheets of plastic or whether or not she was referring to the gowns, which they do now have. Now, I'm told by the nurses that, yes, indeed, they still do have some of those sheets of plastic left over, but she says nobody that she knows is wearing them, that they do now have gowns at this point. Mark?
So, Jim, what happens next? Do the nurses hold a vote?
Yes, they will eventually. What happens now is they sent off their election petition to the National Labor Relations Board, and they also sent off authorization cards. These are cards that co-workers would sign saying, yes, they agree a union should be formed. Next, the NLRB will contact the employer, Milford Regional, and they'll want to see a list of employees because they have to make sure there's enough interest here. You have to have at least 30% of employees say, yes, we want a union. Again, the nurses say they have 70%. Once that's been determined, they will schedule a vote, usually 5 to 7 weeks out. The NLRB will usually hold it on site. There'll be a ballot box. They'll supervise it. Paper ballots will usually be used. And when the election's over that day, the ballots will be counted, and a simple majority will mean, if it wins, that means that the union will win. However, the nurses are looking to see if they can have a mail-in vote because of COVID, of course. During this period of time, by the way, the hospital could challenge that. They could mount some sort of a legal challenge. Mark?
Hopefully they come to some type of agreement soon. Those nurses are doing an outstanding job. Everyone really in the health community pouring themselves into their daily roles trying to get rid of COVID-19. Jim Morelli reporting live for us tonight in Milford. Thank you.